delighted to welcome to our podium Dr. Amy Fairchild, Professor and Dean at The Ohio State University College of Public Health. Amy arrived here in 2019 after leadership assignments at the University of Texas, Texas A&M, and Columbia University. She is the third dean to take the reins of public health leadership at Ohio State. In her work, Dr. Fairchild helped establish the field of public health ethics, a field that is concerned with the well-being of populations, as fundamentally distinct from either bioethics or human rights. When related to populations, ethical considerations teeter and totter between individual rights and the responsibilities of the state to ensure the common good, and the tensions between the two are substantial. Consider for a moment the worldwide stage where the well-being of populations plays out every day. Consider the script, a script with the working title, "Who Shall Live?" A script written in values, a script written in choices, a script that reveals the challenges facing global populations, where poverty is structural, cultures clash, and the environment is threatened on every front. This is the public health stage. And on that stage, Dr. Fairchild emerges as a formidable player. Upon arriving at Ohio State, she observed, quote, "Any university with the chutzpah to have a poison nut for a mascot is the kind of place I want to be." End quote. Please give a warm Rotary welcome to Ohio State Public Health Dean and Professor, Dr. Amy Fairchild.
Thank you all. Thank you for having me, and thank you, Steve, for that lovely introduction. I don't know that I've ever been described as formidable before, but I really appreciate your introduction. It's a thumbnail in some ways of what I want to say today. So if you didn't put the timing together, I came to OSU right before the pandemic started. I was the dean of the College of Public Health, and we have a university of 66,000 plus. And I got brought in and worked at the level of the university and essentially setting up a small, kind of narrowly focused health department within OSU. And it has been a life-changing experience for me. And it has brought together everything I've studied from the beginning of my career when it comes to ethics, value, evidence, what counts as evidence, all to bear, and it's something I'm beginning to write about now. So you're kind of the first test group for how I'm thinking about public health over the course of a century. And you probably heard these two phrases a lot in your lives. Facts, not fear. Anybody heard that phrase before? Anybody remember what the origins of it were? Remember when you first heard it? So it was the AIDS epidemic. Facts, not fear. And you probably heard this one a lot. We're just following the evidence, following the science. So, I'm a historian who works on issues of ethics and policy in public health. So for me, these aren't guiding principles. They are rather phrases that are located in a particular historical moment, and they have historical origins. And they ironically capture, for me, what I see as the main challenge of the field of public health, and that is it is not purely a scientific undertaking. It is, to be sure, science is critical to what we do in public health, but public health also touches on our systems of values, principles, and democratic practices. Public health depends on public deliberation in the public sphere. It's dependent on policy making. It's dependent on people making their case or not making their case. So just to give you a quick roadmap of what I'm going to cover today, I want to talk to you about my understanding of public health, and it resonates a lot with Steve's, the values that drive it, and why my many years now, and I've been in the field a long time, I've been in the field some 30 years, why my many years of research in the field have really convinced me that this is a moment in which we as a country, whatever side of the aisle we're on, we need to be sitting on the edge of our seats and paying close attention and coming into dialogue with each other about some central questions about who belongs and who's responsible in our country. But before that, before I launch in, let me just acknowledge that I know we all come to these talks, and so usually I speak with academic audiences, and people are pretty well lined up. I know what their politics are going to be. I know what their values are going to be. But I come to talk to you with, and I'm bringing the assumption that we don't all share the same values, that we don't all share the same politics, and being transparent that these conversations about public health are really challenging right now. But I start from the place of acknowledging those values and acknowledging value conflicts, and that's my belief is that's how we get through these moments together. Let me go through these three questions. So, what is public health? You might think before the pandemic, you probably thought, well, public health is the hospital safety net. As a consequence of the pandemic, you might think public health is all about masks and vaccinations and quarantines and isolation. But a defining element of public health is its emphasis on populations. We think about health not one person at a time, but we think about it acting at the level of groups, of communities, of cities, of regions, of states, acting at the level of the globe. And so, as I said before, this necessarily involves some democratic deliberation and decision-making about equity. Equity in the distribution of opportunities and resources, and equity in terms of what's the health outcome at the end of the day, and what do we want as a society. So public health, as a consequence, necessarily operates in the public realm. So it's not just a scientific undertaking in which evidence speaks for itself. I mean, you've seen over the past 2 years, we've had evidentiary gaps, we've had conflicting evidence, we've had evolving evidence, and public health, nonetheless, we have to make public health decisions as a society in the face of evidence that always doesn't give us a clear answer. So as a result, I define public health as an argument. It's an argument. It's an argument about what we owe to and sometimes must do to each other in the name of our common well-being. And I think public health can't be understood without acknowledging a civic vision and civic values that guide decision-making in public health, or that should guide decision-making in public health. And democratic deliberation is at its core. And so, as a result, whether the field acknowledges it or not, and this has sort of been my lifelong quest to say, let's always acknowledge our values. Let's don't sweep our values under the rug. Let's tell people what's guiding our decision-making. Public health is rooted in values. So, what are public health's values? So, public health isn't just a system of practices. It isn't just disciplines like epidemiology, and you probably all have heard that discipline now, or biostatistics. It's not just a coherent system of conceptual frameworks that tell us to think about what are the social and economic determinants of public health. What are those things that happen way downstream that shape individuals' choices and life chances? But since about 2000, the field has really begun to coalesce around a kind of coherent ethics of public health. And whether it's expressed as communitarian values, stewardship, solidarity, it's not a word I tend to use a lot. It's a word public health people don't like because solidarity can be very easily linked to the idea of socialism or reciprocity. Public health ethics frameworks uniformly prioritize the common good as central to the practice of public health. That doesn't mean individual rights, human rights don't have a place, but they tend to be a check in the way we think about it in public health. And so all of the public health frameworks, this is what everybody who is coming out with a public health education tends to be guided by, is a framework that's committed to social justice and advancing equity in the distribution of resources that shape those population health outcomes. So that's where people in public health tend to come from. Now, my premise, as I think about this, and I'm somebody who's sort of navigated the field with a very clear set of values, but have not always weighed in ideologically where people might think, or in partisan ways where people might think I might weigh in from those values. So through my own experience, I know that people can disagree without being either immoral or ignorant. And I've been accused in my life of being both immoral and ignorant because I was flying in the face sometimes of what the main field of public health felt on a particular issue. So this is not to say that I think that all values are equal. And I think there are, the vast majority of us would acknowledge that there are some values that Americans the vast majority would say are abhorrent and aren't reflective of who we are as a nation. Or that all information is valid. Well, it could be this, it could be this. We really are in a moment in which we're combating a tremendous amount of disinformation in which social media is making that a challenge for us. So I do think we have to call out disinformation, and we have to call it out in ways that can continue the dialogue. At the same time, I do think we have to contend with some really compelling evidence about the price, not only to different groups within society, but to all of us, regardless of what our occupation is, regardless of what our income level is, of failing to attend to public health at this moment. So that was kind of a long way of preamble, but my point is that the evidence in public health underscores the reality that we're physically interdependent. We're socially independent, we're physically interdependent. And I'm going to come back to that idea at the end. But for now, I want to say, why do we need to care about public health in this particular political moment? And one reason is that between 2000 and 2022, public health officials in the U.S. encountered two new challenges. Not only did they have to respond to this historic pandemic, COVID-19, but they also faced unprecedented levels of public hostility. So I think you probably followed what happened in this very city, what happened to Amy Acton, who was our health commissioner at the beginning, where she had armed protesters in her yard. And in speaking to her, she would say, every fiber of my being was telling me to go out there and talk to them, and I couldn't, because there were people with potentially loaded weapons in my yard. And so in some places, this public health, anti-public health campaign was marked by disinformation, so particularly on social media, court challenges to public health mandates, a newly energized anti-vaccination movement, together with organized challenges to social distancing, lockdowns, masking, vaccination. But it also included, as happened with Amy Acton, threats of harassment, threats of violence, and in some cases actual violence. And the public health sector is still reeling from this fallout. In the first year of the pandemic alone, there was a big national survey, and at least 190 high-level public health officials around the country left their jobs because of this experience of threats and harassment. So this exacerbated ongoing public health workforce shortages, and it sets the prospects for people being willing perhaps to go into the field of public health. But the other thing that happened, of course, was the Black Lives Matter movement, and the call to address structural racism, the call to address the deaths of African American people, particularly African American men, And it's sparked a national reckoning with racism. In Columbus here, we have had the city declare racism as a public health crisis following the murder of George Floyd. And we've seen during this period, too, the rise in extremist violence. We've seen, for example, reactionary responses from the white power movement as early as the Unite the Right rally in Charlottesville in 2017. We've seen this acerbic political discourse blaming Asians in the United States for the pandemic. And we've seen assaults, many of which are violent attacks against Asian Americans, just increase astronomically during this period in time. Well, so these are hate crimes. And the same would be true if we looked at the data for people who are Jewish, people who are Muslim. We see the same kind of data over the course of the past couple of years. And in the case of Jewish Americans and Muslim Americans, that trend has been continuing, that began really with the election of Barack Obama. But I want you to look at these data from the Southern Poverty Law Center, because this is what I find so sobering. They found consequential percentages. So this, if you can't read that, this was a question of, this was a question that asked about approval levels for threatening a politician who is harming the country, our democracy. And what was surprising to me is if you look at, I don't know if this has got, oops, that was not what I wanted to do. For both young Democratic men and young Republican men, the percentage of the population surveyed who believe violence is a legitimate political tool is something I think we need to be paying attention to. And you see the same pattern, younger Democratic men, younger Republican men, in saying yes to participating in a political revolution, even if it is violent in its ends. So we think we have to look at data like this. And this is a far broader report, but and it's resulting in the mainstreaming of violence and discussions of violence. And this is touching, as I've said, the field of public health. I don't know if any of you read the threats to Anthony Fauci were recently released. They're brutal. I think you would read them and think, how can somebody write this? They're talking about gross violence. It's the language of lynching, head bashing, the things that would be done to his wife, to his kids, how he would be dragged through the streets. And this is what public health officials in the country have faced too. So it's a moment we need to understand. So this is why I say this is one of the most consequential periods when it comes to the history of public health. I think many would say that it's a very consequential period in our national history too, and it's going to be communities like this that are going to be part of taking us forward. So what I want to do quickly is just kind of take a step back and take a century at a glance at public health. This is not the first time that we've had a period of public health backlash. And it probably won't be the last time, but I think it's important, and you're my first folks to really work my thinking through here on this, to look at the broader history, because the pattern I see is in moments of backlash, we are typically grappling as a nation with two questions. And the first is, I'll talk a little bit about attacks on science. Oh, well, apparently I forgot some of my my slides there. That's what happens. But we're grappling with questions of who belongs. Who belongs in this nation? And the question of who's responsible. Who's responsible for providing people? And these, as Steve said, these are the recurrent questions that we face. Backlash is often, but not always, accompanied by a period of national crisis, often the end of war or a depression, but those crises can also stimulate some action in public health too. But we see ourselves as a nation asking these two questions at that moment in time. So my really crude measure for public health backlash is something called a little engram. And you can do this online. These are the number of times the word public health is mentioned in books since 1800. And I tend to take this as a measure of, how relevant is public health to the national conversation. If you were to do a book and magazine or newspaper search, you'd find something, it looks similar to this. But also whether we're willing to talk about public health, because when public health is in a period of backlash, people in public health maybe want to say, well, we're science. We're not public health, because science can be tend to be a safer word. So this is a kind of quick and dirty way to kind of gain the national temperature on how receptive we are to a public health conversation, even though it's a kind of crude measure. So if you look at this period of the progressive era, see this period where, boom, everybody wants to talk about public health in either a book or in a book. So this is a period in which there's really a lot of national agreement about public health. Public health departments are being created left and right. You have abolitionists, social reformers, religious leaders, people like the founders of Hull House, immigration reformers, workplace reformers coming together around this shared vision, political reformers of what we want to be as a nation, how we want to pull people in. It's also the era in which, wow, we've suddenly discovered germs, the bacteriological revolution. And there are these little invisible tiny things that are in our bodies that are causing disease that we can't see. So there is a lot of interest in thinking. There's this new scientific thinking, there's this new social and political thinking, and public health is really on the rise during this period of time. Then you have World War I. So a period in which there's a lot of patriotism, but in the wake of World War I, also a lot of rising nationalism. So this meant sweeping immigration restriction, the Red Scare, the Alien and Sedition Acts, in which it became, there was a lot of concern about political dissent. This was a period of time in which the Klan, the Ku Klux Klan, became very active. So during this period of time, you see a big resurgence in lynchings nationwide. This is the period of time, too, in which the American Medical Association began to say, public health, that's socialism. We're gonna take care of Americans through good old health care. The Shepard-Towner Act, which had been one of the major pieces of federal legislation that was passed to provide for women and children, was rolled back during this period of time. So in answer to this question, who belongs? Well, the answer is, well, not immigrants, not African Americans, not blue-collar workers. So this is a period of a lot of worker labor strikes, and there was a lot of violent labor crackdown. So not people who dissented. And that's where the Sedition and Espionage Acts come in. And the question, in terms of the question of who is responsible, well, you didn't really have a federal government at this time. You had some big health departments, like in New York City, particularly in the industrial Northeast, but it was charities and businesses that came to the fore. There was this real vision in the Hoover years of public-private partnerships. That's how we need to address the health of the nation. So the federal government was relatively weak. It began to pull back from some of these first big national programs for women and children. So you get to see a dip during that era. And then you have the Great Depression. So this is a moment of great expansion, and you have the New Deal on the part of the federal government. Everybody is touched by the Depression. We heard this phrase a lot at the beginning of the COVID-19 pandemic. We're all in this together. This was a moment of we're all in this together. You have the Works Progress Administration. You see the real expansion of the federal government during this period of time. You get Social Security. There are many federal programs that get created during this period. So in answer to the question, who belongs? And we know that not everybody actually gets lifted, but the answer, at least, the collective answer is everybody belongs. Everybody needs to be lifted at this moment of crisis. And in terms of who's responsible, it's the federal government. So that's the answer that we give as a nation. But then we have another period of crisis, World War II. And when you think about the answer to this question, who belongs during this period of time, it's complicated. It's complicated. So it's a period of expansion for civil rights. Pull that. I'll just put some of this in. Whoops. Well, I'm going out of order here. So it's a period of expansion for civil rights. These are the years of the civil rights movement that give way to the women's movement, to the gay liberation movement, and then ultimately to the AIDS movement in the 1980s and 1990s. But it's also the start of the Cold War era. These are the years that McCarthy, Senator Joseph McCarthy, had a lot of sway. But it was the period of the affluent society, which there was this core belief that American democracy, everybody had the opportunity to have that Hoover vacuum cleaner, that Whirlpool dishwasher, that toaster oven, that Frigidaire. So there was a real moment of belief in that everybody was going to have access to the good life. Although the civil rights movement had a lot of impact during this period of time, it was nonetheless really dangerous, particularly if you were in public health, to talk about issues like racism and classism in discussing health. So basically, as a field, public health avoided them. This was a period in time, and I think that's one of the reasons you see that line boop 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 going down, is that we would rather have talk about science. And if you look at the yellow there after World War II, so this is the moment in time in which the NIH funding is taking off, in which National Science Foundation funding is taking off. And what happens in this period of time is that as a nation, and public health just backs down and says, okay, we're really very limited, but we're going to achieve population health through clinical research. We're going to find those moonshot cures, and we're going to get them to everybody. Because if everybody can have their Frigidaire washing machine, of course you're going to be able to get that vaccine or that treatment for cancer or that treatment for cardiovascular disease. So it was an era of real optimism in science, and an era of real optimism that clinical medicine was going to be the place that public health, that health to all was delivered. So I don't think of this as necessarily a backlash, but just as a shifting, some backlash, but also some shifting of focus. Public health, you kind of stay in that little corner, and medicine is going to become the thing that saves us. And so when we think about who is responsible, it is the federal government because they're funding this research, but it's also clinical medicine that's being expected to step up to the fore. This era too, but it's really important. You have real resources going into anti-smoking campaigns, and there are enough in this crowd who will probably remember some of those first attack ads on big tobacco in the late 1960s into the 70s, and the denormalization of smoking. After, not even before September 11th, it's really after the Oklahoma City bombing, a lot of resources begin to go into public health preparedness, and of course that accelerates after the September 11 attacks, and then the anthrax attacks in particular. So there is a lot of interest in and movement in public health science, if not in organized public health. But the other thing that happens during this period of time is during the Reagan years is that one of the things you might remember is that this was a period in rollback in federal responsibility. So he took a lot of programs and turned them into block grants for the states. And regardless of how you feel about that, that's the history. So things like CDC programs for lead paint abatement get put into block grants. They push down to the states that begin to make their own decisions about whether that money was going to stay in lead paint abatement or some other program or not. But it's also the beginning of a lot of public health preemption, where you have, and I can't remember what ALEC stands for, but there are a number of national organizations that begin to produce model public health legislation. And that's preempting the power of public health in different states. And you could look at it. The states that are Democratic now tend to be all aligned in terms of very, very liberal, and I'm not using that in a political term, very permissive. I'll use that word, public health and social services, policies. States like Ohio tend to be very aligned in terms of limiting those policies. So it's a period in which we begin to get deep divides in the states too, in how they provide for people. But the other thing that happens is the end of the Vietnam War. And it's a lot more in the news now, but this is the beginning of, some people will call it the alt-right, some people will call it the white power movement, but this is the beginning of real social movements that are you have veterans who had come back from the Vietnam War feeling like they hadn't been allowed to win, feeling like they were spat on and reviled by the American people. And they were facing anti-war protests in the United States, and many of them began to create. Some of them joined the Klan, some of them joined the neo-Nazis and skinhead groups. But there is a coalescing of some of these groups that begin to organize, create paramilitary camps. And I grew up in Texas, and I was completely unaware of this at the time. And I think a lot of us in public health are just becoming really aware of how much we need to be paying attention to this history. But the Klan was very active in harassing and attacking a Vietnamese refugee community in Galveston, Texas. And many of these people had been allies to the U.S. in the Vietnam War, and the Klan was trying to drive them out of Texas. So we have that happening at the same time, and one of the things that's really, I think, important to understand in this history that I didn't appreciate is that Reagan is not sympathetic to these movements, and they find the leaders of these movements find Reagan far too much a representative of the state. So during the 1990s, they really stopped focusing on communism, stopped focusing on different racial groups in the United States, and begin a real anti-government, anti-tyranny focus. And then in the 1990s, that's when we begin to see all of these attacks by these movements that are working in independent cells, but are very well connected through the internet. So let me end by asking this question. Why should we care about public health, about its values, and about who belongs at this moment and in time? I'm going to give you just one example that's going to come, and who's responsible. I'm going to give you just one example that's going to come from life expectancy data. So I'm happy to share this link with you. If you see those little kind of gray lines all around the blue line, those are individual countries' life expectancies since 1980 to 2020. The green is the United States. So regardless of what our income level is, our life expectancy has not, since the 1980s, progressed at the same rate as other countries, and we are declining in terms of national life expectancy at a greater rate than other nations. So this is something that that affects the health of all of us. It affects the health of communities of color more, poor communities more, rural communities more. But it's something that, regardless of where we are in the hierarchy, if I were to ask you, just show you one of those lines and say which, take the country names off, you would probably say, well, I want to live in that top line, which is Japan. And so we all have interests in thinking about how do we lift all of us. So it's because of questions like this, it's because of data like this, that the public health is always asking this question: what kind of collective do we want to be? What kind of nation do we want to be? Some of you may remember the great Barbara Jordan, who was one of the first, I think she was the first African American elected to the U.S. House of Representatives, and then to Congress. And she said, what we want is simple. We want an America as good as its promise. And so I come from this whenever I talk about this, as I think about this, I think of America as being as a place of tremendous promise, and I'm inspired by her words. So how we answer from the perspective of public health evidence, how we answer this question of what we want America to be makes a difference in how long we live. And I could show you these data for COVID-19 deaths, for infant mortality, for maternal mortality, for heart disease, for gun violence, you name it. But this is where I'm going to end and turn the question back to you. So how do we make America as good as its promise? And as important, at this moment in which we are becoming, it feels to me, ever more polarized as a nation, in which it feels easier to dig in when you bring people together who may have different sets of values and priorities than to truly engage with respect and with candor when it comes to a question like that. And that can be a trigger for so much disinformation. That can be a trigger for anger, for violence. How do we there are things that take us to the very core of our differences. So how do we answer this question? How do we make America as good as its promise in a way that still lets us stay in this conversation together, in ways that show our mutual respect for each other and that really create spaces for us to differ, but also to listen. So that's where I end with you today. And I don't know whether you want to have that conversation now or ask questions, so I'm going to hand it back to you.
We have time for like maybe 2 questions.
Sure.
I was first, thank you for sharing this. It's fabulous. I was surprised at Steve's introduction in one way. New York, Texas, and Ohio. Talk about polarization of politics. Can you share, I don't know how much time you were in New York when you started off.
30 years.
So can you share how different and how polarizing the politics in New York versus God knows the level in Texas, and kind of almost in the middle yet a little more in Ohio. Can you share how that has affected?
Oh, I can tell you how that shaped me. So I grew up in Amarillo, Texas, which is in the Bible Belt. My parents met at Baylor University, and my father was going to be a preacher, a Baptist preacher, and he got his undergraduate divinity degree, and then he got his master's of divinity, and then he decided that my mother decided they were going to leave the Baptist church, and he was going to become a psychologist. So you can imagine how popular a decision that was. So and they had grown up in deep East Texas, some of these little communities in which even today, it's pawn shops and gas stations and Whataburgers. And they've been communities that have been left behind by a lot of the progress, and you drive through them and you would think it hasn't been touched since the 1970s, so I grew up in Amarillo, Texas, with parents who had left the Baptist church and went to the Presbyterian church. So my friends would say, "Presbyterian to you all? Are you Christian? Do you believe in Christ?" And they were Democrats. They became involved in the Democratic Party. So all of my friends, were, with one exception, were very religious. Many evangelical. Everybody was Republican that I knew. And I grew up, and my grandparents were very religious and very Republican, so I grew up understanding that I needed to listen. It didn't mean I couldn't share, but that just being obstructionist wasn't gonna help. I was the minority, and so I think that helped me think about how do you navigate these spaces and maybe have a different perspective and a different opinion. Of course, when I went to New York, it's like, oh, she's from Texas. She's a redneck racist. Everybody from Texas is a redneck racist. So you've got to navigate that too. So those were really formative periods in my life. But I would say also the case in public health. Public health is a community where there are some of us who've tried to push some really challenging conversations in public health, and someday I'll tell you all about my sort of contrarian views on electronic cigarettes that often get me into trouble with the public health community. But so I hope that answers your question.
Just one more if we could, because we're coming up on time.
Oh, I'm gonna go with beauty before age. Yeah.
I was noticing, I don't know if you know the background, but the major project of Rotary is to eradicate polio.
Yeah.
And we put a lot of money into that project over the years. But,
Which I've written about in part of my life too. I've written a lot about polio.
Okay, to overlay that with your graph in the 40s, 50s, when I was a kid going through school, then you see everybody can, I think, identify to that problem. Nobody wants to be laying in an iron lung.
Yeah.
That was the fear when I was
And it's kids.
junior high.
Yeah, no, that's right.
It's just because I had a classmate that wasn't one, and it wasn't fun.
No, I think it's interesting.
And to overlay that with your graph.
That's a really good point.
That project to me is something everybody can focus on because they see this image. Not the one of people running around, do you wear a mask or don't you wear a mask? You go to the office, you stay home, all these things are cluttering up people's mind when it used to be, this is the way you do it. You go down to the office.
Yeah.
Nobody had even thought about a mask.
That's a great example, and I'll add that in there the next time I do this talk, because I think that's one of the, polio is one of the things that, I mean, that is a public health challenge, and it was spearheaded, by the Rotarians, by early in the 1920s, by the Elks, by the National Foundation for Infantile Paralysis, which is a real private effort to make a huge public health difference.
I can see where that is a world of public health, because you don't want to transmit it back to others, where some of the other things are, well, I'm worried about my county or just people that are around me close, not even the whole United States.
I sure can. So, but I'll say one thing. So, just pay attention to what's happening in New York, right? So we have polio and the wastewater again. My hope is that we're going to be able to do that on the OSU campus. So we're still doing wastewater. We're doing wastewater monitoring of COVID-19. We started that in the pandemic, but that's something to take seriously, because it's, as you remember, from an epidemiological point of view, very few people get paralyzed. It's very dramatic, but there are many, many more cases under there. So we may confront some of these questions about vaccination and mandatory vaccination when we come to polio. I had a recent discussion with the health commissioner. Childhood immunization rates are falling, and that could have consequences. I mean, measles is a deadly disease for kids, and they can lead to hospitalization. So we need to think about the potential fallout from this period of COVID as we don't let these other child health issues or any other issue fall off of our radar.
It's as simple as when you had to have vaccinations to go to school. So the public health was tied to the public education.
That's right. Exactly. All right, thank you very much. Thank all of you.
So Dr. Amy, we have a certificate for you for being here today. We want to thank you. And we will make a donation to the Mid-Ohio Food Collective in your honor.
Oh, thank you so much. That's a very lovely public health gesture. Thank you.
You're welcome.